Remember, amid the rising COVID cases, the Health Ministry has raised an alarm, saying that the next 40 days are going to be extremely crucial for India. Now, observing the pattern of previous outbreaks that have taken place, the COVID surge is expected from 15 January onwards. The Health Ministry has said that the severity of the infection is lesser. Even if there is a wave, the deaths and hospitalizations are likely to be very low.
Meanwhile, as per sources, the government is also likely to make it mandatory for passengers arriving from China and 5 other places to have negative RT-PCR reports from next week. This because, as per official sources, 39 international passengers have been found positive for COVID-19 out of the 6,000 tested on arrival in the last 2 days. Let me go across to my colleague Akansha, who is joining us live in the broadcast. Akansha, that's of course the information that we are tracking in as per sources. It has been said that the next 40 days, are going to be crucial for India, as it is being speculated that the COVID surge is expected to happen post 15th January onwards. Well, absolutely, and the Health Ministry is working in a war-footing mode to make sure that the situation does not go out of hand in India. As per the fresh statement issued by the Health Ministry, it has said that it is very tough to predict when the 4th wave will come, but the month of January will be very crucial. In fact, the next 40 days will be very crucial for the country. The ministry cited this by stating the pattern in the last 3 waves. It said that in the last 3 waves, when the surge happens in the East Asian country, it first hits the Europe, then America, and reaches India in 30 to 35 days. So keeping that in mind, the month of January will be very important. In fact, the Health Ministry went on to say that there could be a surge in cases in the month of January. However, it maintained that the deaths and also the severity of the cases and also hospitalization of the people will remain low. Talking about the mask mandate, which the government over the last 1.5 weeks has been maintaining that there is no plan to have a mask mandate in India, also in view of the coming festivals and also the new year. It has maintained that people have to remain vigilant, they have to remain aware and wear masks in the crowded area and also maintain social distancing. They've said that this BF7 variant, which has caused havoc in China, the process to get it here has started, and also
that's the reason why the surveillance has also increased. Akanksha, do stay on with us, because the Union Health Ministry has of course taken stock of the situation, given a caution that the next 40 days are going to be extremely crucial. The states are also taking their own efforts to ensure that they curb the spread of the unprecedented wave.
We have seen the mock drill take place yesterday all over India. Pan-India, the COVID mock drill in hospitals have taken place to see the preparedness of the hospitals regarding COVID. But what do we see today in Shialda station? People are coming out, but there are no masks. Certainly the fear of masks have gone for the people of Bengal. That is what is clearly being seen.
हम हैं झारखंड का।
झारखंड से आए हैं। कोविड तो बढ़ रहा है, मास्क नहीं है, डर नहीं लगता?
नहीं है, बैग में है, लगाएंगे।
पर डर लगता है? वैक्सीनेशन लिए हैं?
हाँ, लिया हुआ
है। ठीक है। आप तो मास्क पहने हुए हैं, असम का है, असम के हैं, मास्क पहने हुए, डर लग रहा है क्या? थोड़ा तो डर लग रहा है। तो इसीलिए तो दूसरों को क्या बोलेंगे? सब तो बिना मास्क पहनना चाहिए।
Despite knowing that there is a lot of rise in COVID cases in the various countries, and yesterday we have seen mock drill had been conducted in all the hospitals to understand.
कर देंगे तो ठीक रहेंगे, बाद में एकदम सब कुछ होगा तो वो होगा नहीं, फिर एकदम से कंट्रोल सारा कुछ।
कोविड दोबारा से बढ़ रहा है तो लगता नहीं मास्क डालना चाहिए?
जी सर, डालना चाहिए सर।
तो आपने तो डाला नहीं?
सर मेरे पास है नहीं सर अभी, क्योंकि मिला नहीं था यहाँ के, इसलिए। नहीं तो डालना तो चाहिए ही। केंद्र सरकार ने प्रॉपर गाइडलाइन तो दे रखी है सर, तो इसलिए करना चाहिए उन्हें। प्रॉपर फॉलो करेंगे तो कोरोना ज़्यादा बढ़ेगा भी नहीं इस कारण, इसलिए अवेयरनेस बहुत जरूरी है इस टाइम।
We can see that some of the youngsters who are waiting for the train here, they are saying yes, of course there is need to put the guard on once again the way the cases are going up, but at the same time there is need to create more awareness among the people.
Now let's also take a look at India's preparedness when it comes to nasal vaccine, which is expected to roll out soon in January.
seeing right now in my hands is Incovac, the newly launched Bharat Biotech's intranasal vaccine. It is the first ever intranasal vaccine for the COVID relief. You have to use 4 drops in each of your nostrils to get relief from COVID, and it is the first intranasal vaccine. We have seen how we had vaccines like the Covishield and Covaxin. Now after the heterologous booster, this is the another launch of the vaccine by Bharat Biotech, and this would cost around 800 excluding GST. So it will cost, if it includes GST, it will cost around 1,000 rupees. This would be available on COVID portal as well, and this would be available from the 4th week of January.